A new profession is emerging in geriatric services. It's called care management. The role of a care manager is like that of an adult child, watching over an elder, offering advice about living situations, health care, and financial protection. In a moment, we'll talk with a care manager, but to illustrate her role, we visited with two of her clients, a 95-year-old woman named Ruby and Ruby's guardian, Anne. Our visit with Ruby at the private care home where she lives coincided with her nap schedule, and she couldn't stay awake. But we visited with Ruby's guardian, Anne Logan. She found this home for Ruby to live in with the help of Karen Buchanan, a care manager. Anne pays Karen from Ruby's trust.
I decided to hire Karen and use Ruby's money for this care because I felt it was so important that she had the expertise on the medical field that I did not have, and she had the resources and she knew where to go, that it would have taken me a lot longer to find out. So I feel that the money that we spend monthly for Karen's services is just well worth it for Ruby and has given her a lot better care than she would have gotten elsewhere.
Jim Lloyd is another of Karen Buchanan's clients. When they met, Jim was living in a nursing home, but as care manager, Karen helped him move into this same private care home where he's more at ease.
If there's a problem that arises and everything, I can call Karen. She's over here instantly, taking care of Ruby and take care of her needs and kind of directing me on what I can do to make it better for Ruby. And so I feel that it's worth everything to have Karen.
Joining us now to talk more about what a care manager does is Karen Buchanan, who is a member of the National Association of Professional Geriatric Care Managers and also has a company here called Colorado Elder Care Solutions. You're a registered nurse who does a lot more, isn't that right?
That's exactly right. I do care management, which is coordinating care for elderly. Usually there's some level of dementia involved, and oftentimes the families are out of state or they don't have any family.
And that's where I can see this would be very helpful to a family. As you say, if they're out of state, they would like to have someone who kind of stands in for them to take care of things?
Exactly, and communicates with them. We call I interact with the physicians. A lot of times I get additional services in there like physical therapy. I help with placement, and I communicate with the family the whole time so they know what's going on and they're comfortable with what the plan of action is.
So, and you're looking at the whole picture for this person rather than just the physical care or whatever the problem may be.
And additionally, as a care manager, I have all kinds of access to resources within the community that they wouldn't know about if they were in a different state, and oftentimes wouldn't know about even if they were in this state.
Now, your clients can be either in their own homes or in a nursing home situation or assisted living?
And that can be an assisted living facility, or it can be a personal care and boarding home where they have homes and there'd be 6, 8 residents living in the home with a 24-hour caregiver.
Now, what if someone then, of course, needs to go to the doctor? Do you take them yourself?
I usually arrange for the doctor's appointment. I anticipate the need to see the doctor. I schedule the appointment, and I also schedule transportation so that that client gets to the doctor's appointment safely, and then I meet them there.
So that you can help make sure that the doctor attends to anything that is necessary at that time.
Right, because I know that individual, I know the medication they're on, I do physical assessments during my visit, so I know if their blood pressure's been high, I know if there's been fluid in their lungs, I know what's going on with them. I check their feet, I know what their skin condition is, and I can alert the physician to any changes. I talk to if there's caregivers in the home or if they're in a facility, I know what the concerns have been of the caregivers so that I can share that information with the physician, which makes him or her able to really provide the best care. When you isolate and you don't let your family know what's going on, then you also become at greater risk. And one of the things that I've done in the past is I get the no solicitation on the phone so that solicitors can't exploit them. And I also get companions in there who are trustworthy people that will be able to interact and provide a social outlet.
And are these companions who know these people?
No, they're not. They're companions that I know. And I introduce them to the individual and that see if they can build a relationship, which they can. because oftentimes they're very lonely.
You've said that sometimes it's easier for them to bond with someone who is, that they see more as a professional.
Part of the dementia process involves depression and suspicion of the people who have known them the longest and who love them the most. So they a lot of times will not trust their family members, but they'll trust me or they'll trust a companion.
The people who do this are people who like spending time with elderly people.
They get a lot out of it. The companions that I work with get a great deal of satisfaction in knowing that they can share. You know, they might bring a peach to somebody in a nursing home and just get a lot of enjoyment out of how much that client enjoys that. Or they'll take them for a ride in the wheelchair outside to enjoy the sun. A lot of the things that the staff just don't have time to do. Mm-hmm. That makes a huge difference in their life.
Yes, I can see that. And I would think give some peace of mind to their family or whomever has contracted with you, that someone's paying attention to them as an individual.
Exactly, because we look at the whole, we look at the physical needs, the psychosocial, the clothing, you know, every part of their care need is addressed by the care manager, and then we access different services within the community to meet that need.
What about the exploitation of some elderly that we know happens all too often?
That's always a big concern for families, and also one of the big reasons that care managers are called is to look at ways to protect the elderly. In one situation, I had a gentleman who was being exploited terribly by telemarketers, and it was as simple as getting a non-solicitation on his phone and looking through his mail and making sure he didn't write any more checks to the people asking for money.
Were you able to stop the mail coming to him?
Not really stop the mail coming to him, but to look through the mail with him. He would let me do that,
I see.
And I would throw away all the requests for money.
So you really can look at any need there might be in this person's life.
Right. Anything to help them have a greater life and a safer life.
How are your services paid for?
Well, right now, for the most part, care management is paid for privately. There are some companies that have it included in their benefit package. There's long-term care insurance that is oftentimes paying for care management, and hopefully Medicare will include this at some point in the future.
It is a growing need, isn't it?
Absolutely. It's a great growing need. In Colorado alone, between 1990 and 1998, there was a 21.4% increase in the aging population, and they project that in the year 2020, 14% of the population will be over 65.
Thank you very much. Karen Buchanan is with Colorado Elder Care Solutions, a care manager. She joins us today on LifeWise.